Hello, my name is Grace. For those of you that are watching the video online, I work as an oncology nurse coordinator for Kaiser Permanente. And for those of you that are here participating in my presentation, thank you so much for participating. I am doing this project as my final senior project for my RN to BSN degree through Columbus State University. This presentation is about increasing awareness of compassion fatigue in an oncology setting. So I wanted to start this presentation and program with a few basic questions. Don't worry, you don't have to answer them, but just wanted to give you an idea of what we're going to talk about and some things to think about while we're going through this presentation. So can you define compassion fatigue? Can you provide an example of compassion fatigue? Are you or someone you know suffering or have suffered from compassion fatigue? And then overall, how would you rate your professional quality of life? So the goals for this project were to, number one, increase awareness of the problem that we have in oncology with compassion fatigue, and then secondly, to provide a valuable resource that can be utilized to help those with compassion fatigue. So here's the answer to the very first question, and this is really the bread and butter of the project. Compassion fatigue can be defined as fatigue, emotional distress, or apathy resulting from a constant demands of caring for others. And as a result of routine and chronic exposure to human suffering combined with pressures to provide quality care, oncology nurses are in a prime position for developing compassion fatigue. Basically, we all are at risk for developing compassion fatigue because of the work that we do. Here are some of the risk factors. In addition to working with oncology patients, we also have possibly other work conditions as well as personal conditions that can increase those risk factors. And some of those would include workplace negativity, which we don't deal with here, but some people do. Personal circumstances, especially dealing with the burden of taking care of aging or elderly parents, and then current events such as the mental health stigma and any political upheavals. And please, if you have any questions during this presentation, don't hesitate to just let me know. This slide shows a picture that demonstrates how compassion fatigue can lead to either burnout or even secondary trauma. So over here we have compassion satisfaction, so we're all happy with our jobs. And then over here we have compassion fatigue, which can lead to burnout, turnover, everything, or even secondary trauma, such as having nightmares about work or being very anxious to come to work. So I wanted to talk about the patient outcomes. There's no doubt that there's plenty of research that has revealed that compassion fatigue can and does have a direct effect on patient care and the stability of our healthcare system. As we know, a patient does not care how great of a nurse we are unless we can show how much we care. And as we saw on the previous slide, compassion fatigue can lead to burnout, which leads to turnover, which causes additional stress on the nurses that are still working there. And so what I really wanted to highlight and what's surprising is the cost of turnover, which can be attributed to that burnout. So the cost can be upwards of $50,000, and this data was from 2015. And those costs include overtime for remaining nurses, advertising, hiring, background checks, training cost, and that is an outrageous amount, and that's per nurse. So some Signs and symptoms of compassion fatigue include absence of work, lack of work or team effort, irritability, depersonalization, and either being hypersensitive or actually insensitive to emotional situations. And then some personal signs would be being physically tired or feeling exhausted all the time, and isolation from loved one, increased physical ailments, drug and alcohol use and or abuse, and then poor self-care. So how can we actually improve? I think we really need to get organizations involved in providing education and awareness of compassion fatigue. And every employer has an employee assistance program, but how many people do you actually know that use it? It can be a difficult and convoluted process, all while you are feeling judged for the way you feel. So this slide shows the draft of the type of resource that I envision that we could use for oncology nurses and people that work in oncology. It's a quick trifold brochure that includes the definition of compassion fatigue as well as some of the symptoms. Additionally, it has some resilience techniques in the way of tips and tricks here. And then it would also include some useful resources. And I would love feedback from you all if you have any additional ideas on what should be included, especially in the way of the useful resources. And that was just a draft, by the way. So although compassion fatigue has been my passion for the last couple of years in increasing awareness in oncology, I obviously needed to do a lot of research to ensure that I provided information that was evidence-based. I won't read from the slides, I'll let you review them yourself. If, however, you want to read an article, they're all cited on the reference page. And if you need help getting those articles, you can just let me know. But I do like to read the quotes. So stress, anxiety, and coping are among the most prevalent workplace issues for oncology nurses. In addition to stressful situations, oncology nurses frequently ignore or neglect their emotional experiences when caring for patients with cancer. So that's very important to note. And then oncology nurses have increased exposure to prolonged illness, tragedy, loss, and premature death of patients. As a result, they are at a higher risk for developing compassion fatigue. There's a lot more resources and references, but those were the key research pieces that I used. So assessing change. Let's say we actually initiated a program. How would we know if the program worked? We could, pass out the professional quality of life assessment forms and see what the before and after is, but also a decrease in absenteeism, increase in patient satisfaction, a change in the culture, increase in teamwork and engagement, and then most importantly, the decrease in turnover rates. So turnover rates, that would take a long time to evaluate, but it would be very important to see maybe year over year if there was a decrease. My final takeaways is basically just a review. My ultimate goal is, of course, to increase awareness, to provide basic information, encourage further discussion, help my fellow colleagues, and provide a valuable resource that is useful. This slide is similar to what I've always told family members that are caring for their sick loved ones. You really can't take care of someone else if you don't take care of yourself first. So it's important that we as nurses are taking care of ourselves and assessing our well-being. Any questions? Yes, ma'am.
Was nutrition on there? I didn't see it.
I believe yes. It was. I'm gonna go back to it.
Okay, I just took a real quick glance. Because if this is something that we may be able to incorporate potentially into our UBT, what do you think?
Yeah, I think that would be wise. So for those watching online, she asked if the brochure had something about eating healthy or those type of things. It does say eat a well-balanced diet, but it doesn't go into more specifics, and drinking plenty of fluids, but we could definitely do more specific information on that, and also potentially using this for what we call a UBT project or a unit-based team project. So yes. Again, I want to thank everyone for participating and reviewing my my compassion fatigue presentation. And here are the references. I've sent the presentation to you in the form of a PDF. It'll also be available on YouTube at some point. And again, I thank you so much for participating.
Good job, Grace. Thank you.
Thank you. Thank you. And then here are the additional people that were logged on via Skype. Thank you.